representatives from the Nebraska Medical Center, University of Nebraska Medical Center, and our friends from SIEM are also joining us here today. We're going to start with Dr. Mark Rupp, one of our infectious disease specialists, who has been up in the biocontainment unit, or at least on the floor, and has been corresponding with some of the doctors. Dr. Rupp?
Yeah, thank you, Taylor. So my name is Mark Rupp. I'm a division chief of our infectious disease division here, and I'm our director of our infection control department. I'm very pleased to relate a brief update on our patient that was transferred successfully from West Africa early this morning. The transfer really went very, very smoothly, and the patient is up in our biocontainment unit. Our patient is sick but stable, and we're taking appropriate care of this patient, which we will continue to do so. Our unit is specially designed exactly for this type of patient and for this purpose. It's a very safe environment for the patient as well as for our healthcare providers and the rest of our patients. I would, however, emphasize that we're taking this as added precaution, and really contact isolation precautions would suffice for caring for this type of patient. We know Ebola is a dangerous virus, but it's not particularly contagious. It's not spread via an airborne route, but is spread by direct contact with blood and body fluids. And so we're taking all appropriate precautions to make sure that we care for this patient safely.
Let's move on to Rosanna Morris, who is our Chief Nursing Officer at the Nebraska Medical Center, also Chief Operating Officer, also a nurse. So she can provide things from that perspective. Rosanna.
Good morning. I just want to express on behalf of the Nebraska Medical Center our deepest appreciation and gratitude to not only all of our colleagues, our clinicians, our staff, our nurses who have really stepped up to the plate, have embraced the opportunity to care for this remarkable patient who is doing remarkable things. It is our goal to provide the finest and highest quality care and support this individual to a successful recovery is our hope. We have received much feedback, commentary, and overwhelming support from our community, both locally, regionally, and nationally. Internationally, folks from everywhere are just commenting and really, I think, praying for this individual and providing support in many different ways. We want to acknowledge those efforts and express again our gratitude to them. Thank you.
Thanks, Rosanna. We also have Dr. Ali Khan, who is the Dean of College of Public Health here at the University of Nebraska Medical Center.
Good morning, everybody. I'm the new Dean of the College of Public Health at the University of Nebraska Medical Center. And I just recently retired from CDC and as an Assistant Surgeon General, so I was asked to help represent the university this morning. Let me say a couple of prepared comments first. So our number one priority, needless to say, is to provide extraordinary care to this Ebola-affected patient and to protect our healthcare workers and our community. I think it's important to remember that Ebola does not present a public health threat to the United States. However, this Ebola case at the University of Nebraska Medical Center really makes the point that Ebola and other global infections are local issues and not just global issues. And this isn't necessarily because people would be sent here to the University of Nebraska Medical Center for exceptional care, but because of airline travel and the possibility that somebody may show up at any hospital here within not just the United States, but worldwide. And we've already been seeing that happen in West Africa. The point being that the longer the current outbreak goes on, it's really inevitable that we will continue to see additional spread worldwide, and why it's so important to really shut down this outbreak as soon as possible. And all of you are quite familiar with this happening. We saw this with MERS cases, for example, in the United States just very recently. So these diseases, global diseases, present local issues to us here in Nebraska and in the United States. Now, as you just heard Dr. Mark Rupp say, with meticulous infection control, Ebola patients can be treated in any healthcare facility in the United States. That said, we're really honored to be chosen to provide extraordinary care to this patient, not just because of this extra layer of protection with our biocontainment facility, but because of our dedicated, trained, and really exemplary hospital staff who understand what it means to do serious medicine. Now, as a leading academic Medical Center here at the University of Nebraska Medical Center, I can say three things. We're confident in our dedicated staff. We'll be transparent with all of our actions with our community, and we are going to share the lessons we learned from this patient with the global community. As I've heard and as you'll hear again and again, we have an amazing staff of doctors, nurses, and other medical professionals here who have really been planning for years for this specific scenario. And they've carefully thought through all the critical issues around case management and around safety. Now, because I know you will ask, we have great linkages. Our clinicians and treating physicians have great linkages with Emory and other global physicians who have been very generous in sharing their knowledge with us. And this transfer of knowledge is really important. And we hope that the current efforts here at the University of Nebraska Medical Center will really continue to build our global capacity for how to treat these types of patients and prepare all countries to be better able to respond for subsequent cases. Thank you.
Thank you, Dr. Khan. We'll now move to the folks with SIEM USA. We have Bruce Johnson, who is the president of SIEM USA.
Great, thank you. And also with me is Will Elphick. Will is the SIEM country director for Liberia. Let me just start first. Will and I want to thank you, Dr. Rupp, Dr. Ali Khan, and Ms. Morris for your dedication. Dr. Ali Khan, to me, this is an example of God's provision. He's been following Ebola around the world, studying it for literally decades, and to be able to have him here at this medical center is phenomenal. So thank you so much for your staff, your medical professionals here. Their level of cooperation and commitment for Dr. Rick Sacra and his family, and frankly, just your Midwestern hospitality has really been shown, been encouraging, and very much appreciated. On behalf of Dr. Sacra's dear wife, Debbie, and their three sons, and the global community of SIEM, I want to thank everyone who has had a part in this. This has all happened so quickly that Debbie is making arrangements for her family and will arrive here in Omaha this weekend to be reunited with Rick. Of course, she would appreciate her privacy during these coming days. For SIEM and particularly for Will and myself, the speed and effort to bring Rick back to the United States for his continued treatment of this Ebola virus has frankly been astounding to us. 2 days ago at our press conference in Charlotte, this was an option. Today, Rick's in Omaha. Those involved extend to the U.S. State Department, the U.S. Embassy, staff there in Liberia, to the, of course, Nebraska Medical Center, our wonderful staff, SIM and ELWA medical personnel in Liberia, extended to the evacuation airplane, the crew, the medical staff that were on that, even as I saw this morning, Offutt Air Force Base, to the Omaha Police and Public Safety, to the Nebraska Public Health Authorities, and to the Monrovia, Liberia airport manager and his staff. And I'm sure there's a lot of other people that I haven't mentioned, but our gratitude really goes out to everyone. The logistics and complexity of this operation were phenomenal, and we want to praise God that it came together so quickly and so seamlessly. Rick would actually be somewhat embarrassed by all of this attention. He's a humble man, and when Will and I received this email from Rick Monday morning that his temperature had risen, here's what he wrote. To all of you at SIM and to my colleagues here in Liberia at Elwa Hospital, I apologize. You know, you see, Rick didn't want this to detract or disrupt any of the care of the patients at our Elwa Hospital in Monrovia. You know, he wanted them to continue to care for the people there in Liberia. Rick went on to say, regarding evacuation, I know and accept that there is no easy solution for an evacuation, so I don't expect one. Jesus is right here with me in Liberia. And Dr. Brown, our SIM ELWA medical director, who's Liberian, has a lot of experience now. And the ELWA 2 unit has been discharging a lot of alive patients. I know that with or without evacuation, I could well die from this disease. And frankly, my main concern are for Debbie and my boys, and the ministry of SIM and how that would affect things. I can only trust that God is at work, unquote. This morning I had an experience at the hotel just before coming over here. I was having breakfast, and the person serving me asked me if I was here for meetings, and I said, well, I'm actually here for the Ebola patient. I happen to be the president of SIM USA. He came back 10 minutes later, and he said, I've just activated a prayer chain across 3 states in the Midwest that are praying for Dr. Sacra. Indeed, God is at work. Will and I and the doctors would be glad to take your questions.